Hi, in this video I'll be talking about lymphedema after breast cancer treatment. What is it, what causes it, and how can it be managed? Lymphedema is swelling of the hand, arm, shoulder, or even chest wall on the side of the breast cancer surgery. Risk factors for lymphedema include a lymph node dissection, although we can see swelling of the arm even after just 1 or 2 lymph nodes are removed, for example, with a sentinel lymph node procedure. Lymphedema is also higher in people who have radiation therapy after surgery, and it may be a little bit higher in people who get chemotherapy as well. You will hear lots of risk factors for lymphedema, but we really don't know who's at risk for getting lymphedema other than the type of surgery that you have. It's nothing you did. And losing weight, which is a common piece of advice, doesn't always improve lymphedema, though it may. Lymphedema happens because we're disrupting, with surgery and radiation therapy, the lymphatic drainage from the breast to the rest of the body, especially the arm. So we have lymph flowing all over our body. It's just like in parallel with the bloodstream. Like, think about a railroad and a canal. So if the railroad's the bloodstream, the lymph nodes are the canal, and basically lymph fluid goes back and forth to the bloodstream. If we do surgery and we disrupt the lymphatic channels, the lymph sort of gets stuck and we can see it swelling. If you notice that your hand is perhaps more swollen than before and your rings are a little tighter, that's a sign that you may have lymphedema. We can also see swelling in, as I mentioned, the forearm, the upper arm, and some people, their lymphedema is only in the chest wall, and they might notice that a binder or a bra is leaving marks on one side more than the other. Lymphedema is a side effect that is very troublesome to people. If it's left untreated, it can become really debilitating. So the most important thing with lymphedema is that it be treated early. And it's important for you to advocate for yourself or your loved one to get into physical therapy, for example, or occupational therapy as soon as possible. In the old days, we used to see people with large arms that lost their function. Nowadays, we're doing a lot better getting it recognized and treated early. So what kind of treatments do we have? Well, one of the most important things is to maintain range of motion and strength. We used to tell people don't lift more than 5 pounds after breast cancer surgery, and a randomized trial was done and published in the New England Journal of Medicine showing the opposite, that staying active, that using the arm actually decreases the risk of lymphedema. So it sort of changed conventional wisdom. Now, that doesn't mean you want to start right away after surgery. You're still healing after all. But soon after your surgery, see if you can be referred to physical therapy or occupational therapy or do exercises at home. Another thing that's used is compression. And that sounds unpleasant. Most people find that after they start using a compression gauntlet, which is on the hand, or their arm, forearm above the elbow, or all the way up, they actually notice that the swelling goes down. Lymphedema can also be treated with more advanced technology like pneumatic compression garments. Those are used predominantly in the office of a physical therapist or rehabilitation specialist, and it basically works by pumping fluid out of the arm into the rest of the body. So lots of treatment options. Surgery for lymphedema is used rarely, and it's not something that we usually have to do, where we try to reestablish those lymph channels. What are the complications of lymphedema? Well, one thing is because the lymphatics, which help fight infection, have been disrupted, is that if you get a cut or a break in your skin or an infection, you can be at greater risk of getting an infection of the soft tissue of your hand or arm. That's called cellulitis. So what we recommend to avoid that is that people wear gloves when they're gardening, gloves when their hands are going to be getting dirty. If you're a potter, all you want to do is make sure that you wash your hands afterwards. You don't have to alter your life substantially, but there are a few precautions you can take. One of the things that is a very rare complication of lymphedema is an angiosarcoma. These are bright purple spots that occur in areas of the body that are swollen. That can be in the lower legs, it can be in the breast, and it can be in the area that's swollen. If you see dark purple, we're talking deep purple-violet spots, that's something to bring to your doctor's attention. Again, it's quite rare. I've seen probably 3 cases in 30 years of seeing patients, but it is something that we like to keep our eyes out for when we examine you when you come back. I hope this has been helpful. It's obviously distressing to hear about lymphedema, but I want you to remain optimistic about this side effect of treatment, and we're doing better and better at decreasing the risk of getting lymphedema. I hope it's been helpful for you. If it has, click like and subscribe, and that helps people just like you find this video.